Hello, it's Dr. Rohde. This is another one of my continuing series of educational topics to help you live your best life. What I want to focus on today is something that's near and dear to my heart, male hormones. We'll do another session shortly on female hormones. I think a lot of times men's hormones are overlooked, but we start to have some of the same issues with our hormones that our better halves do. As they go through menopause, we go through what I call menopause. Now, one of the things I wanted to talk about, and I'm going to refer to some facts as I'm going through this, is unfortunately I see a lot of 20 and 30-year-old men that come in. It's not just 50 and 60-year-old men that are having issues with their hormones, and that's why I wanted to bring this topic forward for people to understand that this is much more involved than it seems, and you can't just slap some testosterone on people or put some pellets into people. A lot of times you need to figure out why they're having problems with their hormones and really fix the underlying cause. So starting out again, remember everything in the body begins from your gut or in your gut. If you can't digest your foods appropriately and absorb the nutrients appropriately, or you don't get the nutrients in your diet that your body needs to make the hormones, you're going to have a difficult time keeping things at appropriate levels. So you're needing to figure out what to do with your diet. So if you're eating mostly pre-processed foods that are convenient and easy to get, you need to rethink those things. So let's talk about some of the things that can affect hormones. Number one is toxins, and that goes back to our 20 and 30-year-olds that are having hormone issues, or they can't produce enough sperm to get their significant others pregnant. And we need to figure out why there's an issue with that. And you think about some of the toxins that we have available nowadays, parabens, which are found in a lot of cosmetics and skincare products. And we don't even realize those are in there, but you need to read the labels. Phthalates are plastic-containing components or contained in plastic components, and bisphenol A, which are the plasticizers. So if you have a soda bottle or a water bottle that's flexible, those make the plastic flexible. And one of the biggest tips I can give you is, number one, stop drinking out of plastic bottles. You want to drink filtered, clean water out of glass or stainless steel containers. If you're on a trip and traveling, okay, use some plastic bottles, but otherwise, get rid of the plastic in your life. Those are toxic to our hormones. They're hormone disruptors, and they are literally toxic to the testicles themselves, and so we need to avoid those if we're going to manage hormones. Others, glyphosate. Where do I live? In central Illinois. I still have some glyphosate in my body just from living here, and because I don't detoxify well. And so I know that I don't detoxify well, and I have to work harder at it, but this goes back to really discovering why I have the problem and working on fixing that to improve the hormone levels. And then toxic metals. We're all around toxic metals. We used to have leaded gas that was removed because of the lead in the atmosphere. Unfortunately, there's still lead in the ground. The vegetables that we grow absorb some of those metals, and we, again, bring those into the body, and we don't detoxify well sometimes. So those can be toxic for our hormones. So we need to look for the cause and fix that, as I said. So what are some of the symptoms for low hormones? The biggest thing I probably see in the office is people are tired. And so you need to think, why are you tired? The body doesn't do anything without a reason, and if your body's having symptoms or giving you signs and symptoms, you need to learn to understand your body is telling you something's wrong, and then you need to act on that. So tiredness ties together with sleep problems. A lot of problems occur with falling asleep or staying asleep, and that can be a sign of hormone imbalance. For guys, what I call our executive brain function, we tend to process and think differently than our female better halves do. We tend to do what I call snap decisions. Somebody asks us a question, we make a decision. Sometimes it's a good one, sometimes it's a bad one, but we make decisions quickly, where our significant others contemplate things, network with their friends, and then come up with a decision after some thought. And that's one of the things that starts to cause problems. So memory, word recall or loss of words when you're talking, poor focus, what some people would call brain fog, where you just feel fuzzy-headed and you feel like you can't process, or you're just functioning slowly. Obviously, the sexual arena, low libido, so no interest in sex, or erectile dysfunction, and those are usually end-stage things. Generally, what I see are things that I consider to be more important. the brain processing, and of course other things that contribute to health. Muscle mass may start to disappear, decreased body hair and beard growth. Both decrease. Irritability, so if you're irritable all the time, you're easily frustrated, or even depression. Some guys come in and their mood is down, or like I said, if we start to get an imbalance in our hormones, we start to act more like our significant others do, and maybe we become more tearful at movies, where before, we're rough and tough and we can't show our emotions, but that can be a sign of hormone imbalance. So those are all things to start to look for and think, well, is there something else going on? So risk factors for hormone imbalance. First and foremost, stress, okay? Anybody living with any of that right now? I'll tell you what, it happens to everybody. Stress increases cortisol. Cortisol affects our hormone balance. All of our organ systems in the body work together, and so again, just slapping some testosterone on your body or injecting it or putting some pellets in often isn't the answer if you haven't looked at other organ systems that are out of balance as well. Overweight. If you're struggling with your weight and you're overweight or obese, and much of our population is struggling with this, the fat cells metabolize testosterone to estrogen. That further worsens the cycle. As you make more estrogen, you gain more weight. As you gain more weight, you produce more estrogen. The testosterone situation worsens. So one of the biggest fixes for this is getting the weight off, and that's changing your diet, which takes us back to the first topic, and adding in some regular cardiovascular exercise. Diabetes. If you're diabetes, you gotta fix it. And I'm not talking about taking insulin or taking medication. I'm talking about fixing it, which we can also work on. And this is becoming non-diabetic. And that means changing what you put into your body rather than taking insulin or medication to control the sugars, because if you put insulin in, it changes your sex hormone binding globulin, which changes your hormone levels. So we got to fix the underlying problem. Narcotic use. If people are on chronic pain medication, that can affect your hormone levels. That's well known, and that needs to be adjusted. Caffeine intake. Well, here's a tough one for all of us. I love my caffeine in the morning, but it also changes your sex hormone binding globulin, and so you need to make some adjustments in your diet. Smoking, if you smoke, you gotta stop. I mean, there is no good use for cigarettes in my mind, or chewing tobacco. They're toxic, they cause cancer, we know this for certain. And the only two groups of people that benefit from you smoking is, number one, cigarette manufacturers, and number two, physicians, because people that smoke are sicker and they go to the doctor more often. So if you want to continue to contribute to those two organizations, go for it, but you're really going to be struggling with your overall health and your hormones if you don't work to get rid of these bad habits. So again, looking at sex hormone binding globulin, estrogen, testosterone, there are lots of parameters that need to be evaluated, not just simply your testosterone. And that's where well-meaning physicians that aren't expertly trained in this, like I am with a fellowship background, don't understand all the parameters that need to be monitored. And I start to see guys that come in that have had really bad experiences with hormone replacement or significant side effects. And that is where you can get into trouble with hormones. So it needs to be done properly, needs to be well monitored, no different than if you're on insulin. Going back to that point, it needs to be monitored and really adjusted appropriately for your best health. So, important message, we function better with normal hormone levels. Hormones do hundreds of things in our body. One of the most important being our brain function. We got to know what we're doing. That's important stuff. So let me know if I can help you adjust your hormones. We can set up a free 15-minute consultation to see if you're a fit for our clinic. We'd be happy to provide that for you, and then we can set up an appointment for us to go through your history, find out what underlying factors might be affecting your health, and then we can work for you to become your own best doctor and really improve your health. And that's my goal, is to help you live your best life. So let me know if I can help. Thanks.